And I just want to jump back to, because I know this is an area of expertise for you, I would love to just jump back to, I often get questions about binders, and it's such a broad topic. And when I say binders, just for the people in the audience who don't know, people will often take binders with a biotoxin illness, mold, Lyme, to try to bind toxins, move them out of the system. The idea that you'll relieve the body from toxicity and feel better. Myself, I've never really been able to tolerate a binder long term. It just depends. I've had a little success with some. Generally, I'll give you a perfect real world example. This week, I got really inspired after listening to a Quicksilver scientific podcast. I grabbed their Ultra Binder, which is fine clays and charcoal. And then there's a supplement that actually, it's called the Push Catch. So you drink some herbs, some bitters that are going to move a little extra juice to the liver through the bile, and then you time to take that supplement after to almost catch those toxins coming out of those organs. And I feel terrible. Like in 3 days, I feel like I got hit by a car. Like and I'm generally pretty pain-free. I mean, feel and brain function's fine, energy's great, but it's so acute, and it's such an acute reaction to these binders. And I find in this community, that's what I hear. People have such a different response to these things in their body, and there's no consistency whatsoever. Again, I guess we're going to root this back to the limbic system and the vagus nerve being sensitive to No, not. This is a different thing. This is different. Now, if the limbic system and vagus nerve are dysfunctional, that reaction will be stronger and worse. But this is a direct reaction to the binder. Mm-hmm. So let's talk binders. If you don't mind, a personal question. Have you yourself had a urine mycotoxin test? Yeah. Okay. And what does it show? It was a year ago. It was very high with ochratoxin A, very high with gliotoxin. A little, what's the one that starts with a T that's associated with Stachybotrys? Trichothecene. Trichothecene, a little bit in there. And then my last one, which is 2 months ago, everything was normal, except the highest one was aflatoxin. So everything was down to normal except aflatoxins, which was cut in half. So okay. I've still got some work to do on the aflatoxin. Okay. So that gives me a greater context to answer your questions, and I'll make it about you, but other people can generalize if you like. Please make it about me. Well, you get a free consult. How bad can that be? That's awesome. Okay. How bad can that be? Okay. Now, let's understand how binders work, which I don't think we understand. And I also have a very strong bias that anyone with any sensitivity can't take combination products like Quicksilver offers. Then you have to start with very, very tiny doses of binders that you can take. And I'll even give you some guidelines to work with. Mm-hmm. The problem with the word binder is that the connotation is that things are bound tightly. Like imagine my hands clasped tight together. Mm-hmm. So that the picture that people have when they use the word binder is, oh yeah, that binder grabbed onto that toxin and it's pulling it out of the body. It does bind, not that way. So, for example, let's take charcoal. Mm-hmm. The way charcoal works, it doesn't actually bind. The word that we use medically for charcoal is it adsorbs, meaning it allows, kind of like static cling, it just allows the molecules of toxin to rest very lightly on the charcoal surface. Is that because of the charge of the charcoal? It is, but it's not tightly bound. Mm-hmm. And that means this very, very loosely bound toxin is moving its way through the GI tract, lightly bound to charcoal. And you know, it's so lightly bound that a lot of those molecules fall off. When they fall off, they get reabsorbed by the body, and you actually get an increase in toxicity. Mm. So if all binders work in such a way that if you take too much of any binder, you're going to actually mobilize toxin
faster than your body can excrete it, and you're actually going to get more toxic, which is what happened to you and happens to a lot of people. It's extremely common. So by understanding this is not binding, it's lightly binding. This means that you have to be really, really internally clear that you can handle the dose you're taking with no side effects whatsoever. If anything you take makes you worse, it's too high a dose.
Beautiful.
You can't. And what most people do is they go, well, I'm a bit worse, but I can handle that. I'll just put up with it. If that's what I have to do to come out of the end of this tunnel, I'll do it. Erroneous thinking. Wrong, won't work. All that's going to happen is you're going to get more toxic. So the most important thing about taking binders, or about mold treatment in general with binders, is you have to find doses that a person can take comfortably. So for you, the Quicksilver combo product didn't work. Too strong. It wasn't any other system, just too strong. So given that you still have an excess amount of aflatoxin in your body, that's the one, right?
That's it.
Okay. So the best binders for aflatoxin are charcoal, clay, and chlorella. So for you, I would start with a very light dose of clay. And what do I mean by that? I would get hold of a liquid clay preparation. The one I like a lot, you can get from Amazon. It's called Yerba Prima. And I would start with a 1/16 or an 1/8 of a teaspoon once a day. After a week, if you can handle that, bump it up to a full 1/8. After another week, a 1/4, stay there. Don't keep pushing it. If at any dosage increase you have symptoms, those symptoms are, by definition, that you're pulling toxin into your body faster than you can process it. So it's not a side effect, it's a toxin release. Very clear. Okay. Once you can handle a little bit of clay, then I would add a little bit of charcoal. And what do I mean by a little bit? I'd get hold of a low milligram charcoal capsule, like 250 milligrams, and I would empty it out and take an 1/8 or a 1/4 of a capsule.
Wow.
And you can take that with the clay. You can do it once a day at the same time, away from food, away from other supplements, so you're not binding anything you need. And then we have chlorella, and you can start with some tiny chlorella tablets. You could start with an 1/8 of a tablet, slowly work up to 1. Now, it says on the chlorella packages, take 10 or 15 of these twice a day. Please don't do that.
I've done that.
If you want to go under the bus, great way to do it. So tiny doses of binder in sensitive people work really, really well. You don't have to go to high doses to effectively bind it out, but you've got to get a dose that works for you. So I hope that will be helpful to you in understanding that you had the reaction from Quicksilver means there's still toxin in you. No question about it.
Yeah. Yeah. I mean, it is helpful. I think that lesson is you don't need to throw the baby out with the bathwater, that it's just finding the minimum effective dose.
Right.
Which
there's a plaque on my wall, which one of my patients gave me, and it says, if some is good, more is not necessarily better. And the thinking that I've got to do more, I can never get well with small doses. Wrong thinking. You will get well with small doses, but you won't get better with higher doses.
You know, you must have to coach people out of this all the time.
The time.
Oh, because after somebody's been sick, the only thing they want to do, they're willing to push through any amount of pain if you can see light on the other side. And that's the mentality that you're actually, as you're explaining it, and this is a lesson, believe me, I've learned it myself, is that you push until you're done, and then you just set it down. But it's about moving through with a little bit of grace.
It's about honoring your own perceptions. Your body is not your enemy. It's trying to tell you what you can take and what you can't take. Ignore those messages at your own peril. This is one of those things. The majority of people who find me are type A people. Basically, I don't advertise. I make no effort whatsoever to attract a following, and unfortunately, that hasn't worked very well. But in order to find me, someone's got to be a type A person who's out there listening to podcasts, reading books. So that's who I find. And type A people's way of dealing with the world that was successful for them for their whole life was, don't fire till you see the whites of their eyes, damn the torpedoes, full speed ahead. And it's worked. It doesn't work here. And you're right, I have to give this talk over and over and over again to very bright people. And you just have to hurt yourself repeatedly, as you just did with your Quicksilver product. You have to hurt yourself repeatedly before it finally dawns on you, I don't think that strategy is going to work. Mm-hmm. You've got the Einstein concept, which is doing the same thing over and over again and expecting a different result is the definition of insanity.
Yeah,
right.
So true.
So, but we keep doing it. You're not alone. It's almost routine.
Yeah, we do until we don't. Doctor, I want to be respectful of your time, and I just have a couple more questions I would love to throw at you before we part here. The one other topic I'd love to just touch on for a moment is the concept of EMF exposure coupled with mold toxicity or someone going through long-term chronic Lyme. How do you view that component? Is it problematic? Is it imaginary? Is it real?
Well, first of all, there's two answers to that question because we're talking two different phenomena. One is there is a very real medical condition called electromagnetic sensitivity. That's real, not in anybody's head. I know that people tend to think it is because, well, I'm in the same room with you and I'm not having any symptoms. Why are you having symptoms? This has to do with how the limbic system gets fried, literally, or dysfunctional. So when the limbic system is hypervigilant, it starts to react to things in minute amounts that it never reacted to before. And that includes EMFs. That's a part of it. Very real. When the state of California put in smart meters several years ago, I had a rash of patients who had been high-functioning people who suddenly couldn't think their way out of a paper bag. The smart meters were exposing these people to massive amounts of EMF that they'd not been exposed to before, and it shut them down. This is very real. It was not psychological. Many of them had to move into very remote rural areas, literally minimum of a quarter of a mile from the nearest home, and have no electrical anything going on in order to recover. It just took time. So that's real. There's no question about that. Now, to what extent does EMF affect mold specifically is another interesting question. Dr. Dietrich Klinghardt, who's one of the better experts on both Lyme and mold and chronic illness. I mean, I've known Dietrich for many, many years. He's been saying for several years that asking the question, mold has been around since biblical times. Why now? Why do we have an epidemic of mold now? It's now estimated there are 10 million people in this country who are having some kind of reaction to mold at this moment. Why now? What changed? And I would submit that a lot of things have changed. We are weaker. Our environment is much more toxic. There are tens of thousands of chemicals in our environment that didn't exist 50 years ago. The EMFs we're exposed to, off the charts, never seen before in the history of humankind. So heavy metal toxicity. Who knows how much radiation toxicity we have still from Fukushima? There's so many potential sources of toxicity that I'm quite certain that it's contributing to our inability to handle mold toxicity. But Dr. Klinghart's position, which is really quite fascinating, is he believes that the electromagnetic frequencies are actually irritating the mold itself, making it more toxic. Mold makes toxins in response to being stressed.
Mm-hmm.
So if we are stressing it with EMFs, now they've been around for 1 billion years. They've been on this planet way longer than we have. They have very sophisticated ways of dealing with planetary shifts and changes. They managed us for 1 billion years, right? So we got to honor what mold fungi are capable of doing. And yet, here they are, all of a sudden, getting annoyed and making toxins at a rate that we've never seen before in human history. Could it be the EMFs or other chemical toxins in our environment? Dr. Klinghart believes that that's so, and to be very honest, I can't contradict him. Makes sense to me. Is it true? I don't know. I'm not here to scare people.
Sure.
But I do think that he's raising questions that we really do need to answer. This is something that can be studied, and if we would put our efforts and research into studying this, and it's not being looked at all, I think the lives of many, many people really will depend on it.